Heb je die seintje als hij er weg is? And good afternoon and welcome Europe, because we are with many people from many countries today. So I welcome you live from The Hague in the Netherlands, from the studio where we are recording this webinar. My name is Erik Wisselink. I'm part of the THCS call secretariat team, of which you will see several colleagues today. As I said, we had a lot of people interested in this webinar, so we had over 1,000 registrations. I'm welcoming you all from 30 different countries, over 30 countries people have registered, even countries outside of Europe. So welcome again, and nice to have you on this webinar. The fact that there are so many registrations, I think, shows that the topic of today, so the transformation of health and care system, is important, and that it's a challenge for us to transform each of our systems in our own countries and to make them future-proof. And that's why also the topic of the first call is healthcare of the future. This is the topic that we will present today, and we will present something on on the program, the Transforming Health and Care program, because it's a new program, it's our first call, so we will get something on that. So let me, maybe before we start, I use the acronym THCS, which stands for Transforming Health and Care Systems, but so you know that this is an acronym that is quite often used in this webinar, probably. The goal of this webinar is to inform you about the first call and also on the procedures around this first call. And for that, we have a couple of speakers today. Can I have the next slide, please? Thank you. So first of all, we will tell you something more about the partnership itself. So what is the partnership about? And we have Federico Bastarolo from the coordinating team from the THCS program that will inform you and tell you more about the program, the entire program. Then, to give you a kind of an example or an idea, we have a showcase example of a project that is working on an e-health implementation and also the diagnostic results that it has. So it has to do something with the right care at the right place. And they will give you an example. It is a Dutch project, and they will tell you something on what they did and what they experienced during their project, just to give you a kind of an idea how a project that is mentioning transformation could look like. Then we go into the call text itself. We have Michael Julie from the French funding agency ANR, and he will present the call text to you. And finally, last but not least, we have Marcin Chumelski presenting the partner search tool that we have in place so that you can make use of to search for partners. And I will come back myself as well to tell more about the call procedures and the criteria that we have in this first call. Before we start, some rules, regulations, a little bit. I'm not alone. I have colleagues here in the studio as well who are on the chat. So if you have a question, please use the chat to raise your questions. Be aware that we have a tight schedule, so maybe we are not able to answer all of your questions today. So have a little bit of patience with them as well. And we will try to save all the questions that you have and maybe come back on a later stage with a frequently asked questions form also on the website of the partnership. So don't be afraid that if the question is not raised today, I hope it will come back hopefully at a later stage. This is it, I think, from my side, and I think I would like to hand over now to the first speaker. So Federico, I would like to give the floor to you to present something on the partnership.
Hello, good afternoon, everyone. So my name is Federico Bassarolo. I'm from Promise, affiliated entity of the Italian Ministry of Health, which is the coordinator of THCS partnership. And today I'm gonna present to you what this partnership is about. So let's start. Next slide, please. So first of all, for those of you who are not familiar with European funds, THCS is a co-funded European partnership. What does it mean? It means that it is a partnership that is formed after an open call by the European Commission as part of the Horizon Europe work program. To this call, European member states, together with other public authorities like research funders and similar, are replying to this call, and they're forming up a partnership which is itself then presenting opening calls for researchers and interested parties to apply. Some numbers about THCS partnership. It started in January 2023 and it will last 7 years. It has 63 members, 56 of which are direct beneficiaries and 7 are affiliated entities. It is coordinated, as said, by the Italian Ministry of Health. Maybe you can click to continue. Yeah, it involves 26 countries, 23 are member states, 3 are associated countries with Horizon Europe, and plus we have also 3 non-European countries, which are Switzerland, UK, and the United States. And then, please click again. We have the total budget allocated, which is more than 305 million euros, co-funded at 30% by the European Commission. Next slide, please. Obviously, THCS it doesn't start from scratches, but it builds over some previous actions that were promoted by the European Commission and ministries from member states. Maybe the most relevant ones to quote are the JPI, so the Joint Programming Initiative, More Years, Better Lives, to Reach, which is a coordination and support action for transferring innovation in health systems, the AAL, so the Active Assisted Living Program, and then the AIP on AHA, so the European Innovation Partnership on Healthy Aging. Next slide, please. Here now, let's quickly dive into THCS vision and objectives. As the name itself, the acronym itself suggests, the vision of our partnership is to strive to high quality, fairly accessible, sustainable, efficient, resilient, and inclusive health and care systems for all. So for European citizens and beyond. How we are going to achieve this vision? By achieving our objectives, which is increasing the funding opportunities and strengthening the research and innovation community in Europe, filling the knowledge gap, increasing the ability to implement innovation, intensifying cooperation among countries and beyond healthcare systems, and increasing stakeholders' involvements in all these sectors. Next slide, please. Given this vision and objectives, which are the expected outcomes that we are foreseeing? So first of all, we would like to achieve a stronger local and regional health and care ecosystems. We want European researchers engaged in collaborative research at European and international level. We want health and care authorities and policymakers to use this research that has been produced thanks to these programs in order to result in a better decision making. Please, you can click again. Then we would like to achieve, thanks to our action, a better cooperation among countries in research and innovation in this specific field. We want health and care authorities, policymakers to plan and carry out efficient investments, avoiding duplication in this field, and we want these health and care providers and professionals to implement innovative solutions and to have the means to do so. Next slide, please. How are we going to achieve that? In this slide, we are presenting you the THCS approach that is based upon three major work streams. That is filling the knowledge gap, implementation and transfer, boosting health and care systems. But let's see this in detail. So at the center of everything is our objective. So people-centered, resilient, and efficient and sustainable health and care systems. How are we gonna achieve that? Which is our approach? So first of all is the problem and priorities definition, because the right identification of problems and challenging is key for kickstarting in the right direction this approach and achieving the results we have set up. Learning from practice, so it's key as well to regularly map the existing practices to avoid any duplication or efforts. Then we need to learn. Wait, sorry, there is a last one missing. Can you click, please? Yeah, we have to learn what and why, so to have a clear and consistent methodology in terms of our action. We need to boost the health and care systems, so to strengthen the capacity of health and care organizations, both at European, national, and regional level, supporting as well the creation of ecosystems and the sustainability of innovation, obviously at all these three levels. Implementation and transfer, it's mostly related to the test and validation of the solutions for large-scale piloting. Next slide, please. Here in this slide, you can see the overall actions put forward by the partnership to achieve our objectives. So from bottom to top, at the bottom we have the foundations. So the key components in which the shift that we want to achieve has to take place. So it's the primary care, the long-term care, and the hospital care. The preconditions for the functioning of the sectors are the building blocks of our action. So an adequate skill mix of health workforce, digitalization of health and care systems, addressing the quality concern and patient safety, and efficiency and sustainability of innovation. So aiming at efficient use and of resources and support to innovation. Then we have the thematic priorities. So you can see there are several, but they can be grouped in two major overarching priorities, which are involving and empowering people and the integration of health and care services. And the final objective, as seen in the previous slide, is the to have a more accessible, sustainable, efficient, and inclusive health and care system. This is it in a nutshell, what we are doing with the THCS partnership. Next slide, please. If you wanted to be updated and to be informed about our next moves, please follow us on our website and then as well on our Twitter Twitter and LinkedIn profiles. We are going to produce a newsletter. The first one will be sent out before June. We are planning to send out two newsletters per year, but as well, then we're going to be active with press releases. We are going to also promote the publication in open access of the results of our projects. We are going to promote webinars like this one to present joint transnational calls, but also other aspects of our work. And as well, obviously, we are going to organize conferences to present, disseminate, and promote our activities. You can click. So, okay. And here you have all the references for our website and social media. So this is it from my side. You can find also in the next slide and final one our functional mail address, so you can drop us an email in case you have any question related to our work and our partnership. Thanks for your attention, and hopefully hear from you soon.
Okay, thank you, Federico, for sharing some insights on the partnership, on the Transforming Health and Care partnership that has started since the beginning of this year, 23. I saw some questions also in the chat during your presentation. One of them, I think I will highlight, is the question whether we can share the slides. And of course, we can share the slides. And on top of that, this webinar is also being recorded. So if you feel the need to have a look again, then that will be possible. So I think that's good to know also upfront. I would suggest to go to the next speaker. And as I already mentioned in the beginning, this will be an example of a project that has done something on the transformation of health and care. And it's a Dutch project. And we have two people here with us that can tell us something about what they did. So we have Dr. Marielle Krekels. She's from the internist at Zuiderland Medical Center. And we have PhD candidate Ken Peters. And they will tell something about the project that they are running at the moment and what they have done and experienced so far. Marielle, I will give the floor to you to present something on this project.
Yes, thank you very much. My name is Marielle Krekels, and as already said, I'm an internal medicine doctor in a hospital in the southern part of the Netherlands. And I will give this presentation together with my co-speaker, Ken Peters, who's a researcher and is working on his PhD thesis. And we hope to tell you something about how we implemented e-consultation between general practitioners and hospital specialists now, so some 7 years ago. And maybe to set the stage, because we have an international audience, in the Netherlands, care for patients is done by general practitioners. So it's not possible to go straight away to the hospital if you want to see a specialist. You have to be referred by your general practitioner to go to the hospital. So you can imagine that sometimes there are so long waiting lists in our hospital to see a specialist. And when I was talking to a general practitioner over coffee, we talked about this, that this waiting lists were so long. And we have in the southern part of the Netherlands an older population with a lot of morbidity. And we thought this can, we can think of something that will improve this. So the general practitioner said to me that sometimes he doubted whether it was really necessary to refer the patient to the outpatient clinic. And he was in doubt about that and not sure. And I said, on my part, we see a lot of mainly elderly patients of who we think it wasn't really necessary to see them physically, and that it was also possible to answer the question of the general practitioner and to help him without seeing the patient. So we thought that it would be wonderful to implement e-consultation between general practitioners and internal medicine doctors. And I think what is important to realize that in our region, we only have one hospital. This is a very small part of a very narrow part of the Netherlands. So almost all general practitioners refer to our hospital and use our laboratory. So because internal medicine is a is a specialism where there's a lot of lab results, it's possible to help the general practitioner to advise him about the lab result and to advise him about whether to refer to the hospital or not. So even though I don't know patients, it's possible to look in our database and look and have a lot of results of this patient. Oh, I'm sorry, I forgot to say that you can move the slides. Yes. And the next. Oh, it's blank. Oh, no. So the general practitioner asks the patient and say to the patient, I'm going to consult the specialist in the hospital, and then he or she will advise me whether it's necessary to refer you physically to the hospital, or maybe you can stay here in the primary care and we'll follow his advice. So next slide. When the patient is okay, it's possible the general practitioner will get a letter from us with our advice, and he can discuss this with the patient. In this slide, you can see an example of such a e-consult. Next, yes. And here, this is the case of a 64-year-old male who had an X-ray made by the cardiologist. And there was a small node visible, and the cardiologist said to the general practitioner, well, this is your problem now, and maybe you should refer him to the pulmonologist. But the general practitioner thought maybe it isn't necessary, so he sent an e-consult to the pulmonologist and asked whether it was really necessary to refer this patient to the outpatient clinic. But the pulmonologist thought it wasn't really necessary, and he said maybe you should do a CT scan in a year, and then we can see if there's growth, and then it's maybe necessary to see the patient. So this is an example how a physical referral is not necessary and the patient can stay in primary care. Next slide. And we started this in 2016, and the healthcare insurance was at first a little bit hesitant because they thought, "Ooh, this is new, this costs money." And we tried to persuade them that we thought that a lot of physical referrals, which are much more costly, would be unnecessary. And also for the patient, when he comes to the hospital, it's costly because he has to pay for that, when an e-consult is not for the patient to pay. So we persuaded the healthcare insurance, and they let us implement e-consulting for internal medicine, and 2 years later for cardiology, neurology, and pulmonology. And when Corona came, the pandemic, we asked the insurance company to allow it for all specialisms. So we did it also for surgery and also for urology. And now we have 18 specialisms for which it's possible to ask for an e-consult. And then we thought it would be nice to see whether it really is leading to substitution of care, and that patients can be helped in primary care. And we, with our advice, can help the general practitioner to follow the patient and treat the patient. And there is where Ken Peters comes in. He started to, with the research, to look whether we could prove that this was also good care for the patient, for the general practitioner, and for the specialist. Next slide. So the implementation was actually quite easy because everybody believed that this could be a very good idea. So the general practitioner sends a non-physical referral to the hospital, and we get those patients planned in our outpatient clinic, but we can see that's not a physical consultation. So we open the patient and we can see all the results, and we can read the question and we answer it, and we send a letter back to the general practitioner. And there weren't really a lot, not so much obstacles. Only privacy was a problem, because we had those patients planned in our outpatient clinic, which was inside the hospital, and those patients don't really come. So that was an obstacle, but it was way ahead for privacy legislation. So I don't know whether if we do it now, that it would be as easy. We think that it's a huge success, and I will give the word now to Ken Peters, who will show you how we try to prove that it's contributing to substitution of healthcare. Ken, next slide.
Yes, thank you, Marielle. As Marielle said, I'm going to tell you something about the research that we've done and the results, especially on substitution of care. First, I want to show you some numbers of about how much the e-consultation is used. So far, the total number of e-consultations requests is 12,000, so that's a substantial amount. The average number of e-consultations requested by a GP since 2016 is 86. And as Marielle already said, the number of departments that implemented it is 18. Next slide, please. Basically, the research that we've done so far, I've split it in two parts. First of all, on the one hand, we did a patient file analysis, in which we looked in the patient files and the patient records of all the patients for whom their GP has requested an e-consultation. We did this for 6 departments, and we excluded patients that were already under treatment by a specialist. We looked at a number of things, for example, the topics, the type of questions that were asked, type of advice, diagnostics done by GP or in the hospital. But I'm going to focus now on this substitution of care. So whether avoided referrals, whether maybe extra referrals, etc. And on the other hand, we did semi-structured interviews with GPs, specialists, and patients. To be specific, 15 GPs, 17 specialists, 10 patients before we reached data saturation, and we performed a thematic analysis. Next slide, please. So how exactly did we look at this substitution of care? So what you see here is a cross table for the internal medicine, so the first department that we implemented. And basically, when a GP had to request an e-consultation, we asked them, would you normally have referred this patient if the e-consultation was not available? So did you intend to refer this patient? Then we looked in the patient file if there was a hospital visit within 6 months after this e-consultation. So was the patient actually referred? That basically gave us 4 scenarios. So the first one is that the GP did intend to refer and the patient did have a hospital visit. The second one, which is the green number in the table, is that the GP did intend to refer, but the referral was avoided. And as you can see here, this was 78% of the patients that the GP would normally have referred if there was no e-consultation. The referral was now avoided, but also the other way around. So that's the red number. So normally the GP would not refer this patient, but there was a hospital visit. So it also led to some extra referrals, although a small amount. So if you create a supply of healthcare, it also creates a demand. There's a bit of a pull factor. But you could also argue that this is beneficial for the quality of care, because these are patients for which a specialist said, to be sure, let's send them to me. And then the last category are patients who would normally not be referred and were still not referred. We use this to calculate what we call a substitution percentage, in which we subtract these extra referrals from the avoided referrals and divide it by the intended referrals. And for internal medicine, we got a substitution percentage of 70%. So that's really a substantial amount. Next slide, please. And what you can see here is we plotted the number of either referrals, which are the top two lines, or the e-consultations, which is the bottom line, per 1,000 patients on the vertical axis over the years. So since the start of the e-consultation in 2016. So the black line shows Zuiderland, so the regional hospital in which the e-consultation was implemented. And the green line shows the nationwide trend. So the Zuiderland shows a clear decrease in referrals to the internal medicine department, where the nationwide trend shows either a small decrease or steady or even an increase in the last year. Of course, the last 2 years, COVID has had a effect, but you can see that nationwide the trend goes up while Zuiderland still decreases a little bit. Next slide, please. So we did this for 6 departments. Started for internal medicine, which is for pulmonology, gynecology, cardiology, pediatrics, and neurology. Internal medicine showed the highest substitution percentage. We think this is because internal medicine has a very strong differential diagnostic character. But even for the other departments, the percentage was really substantial. Even for the departments with the lowest percentage, pediatrics and neurology, still 1/3 of the care was substituted from hospital towards GP care. We have some reasons, we have some ideas about why these numbers might be lower. For example, for neurology, if you look at the diagnostics, there's a lot of scans being done, and the neurologists in lots of the e-consultations said, I do need to see him to perform diagnostics. And in pediatrics, we think that it's a complex consult, oftentimes emotional, parents with children. So this might be a little less suited for digital care and more for face-to-face. But still substantial amounts. Next slide, please. So yeah, what do the physicians think? We held interviews. Yeah, next slide. We held interviews with both GPs and hospital specialists and found a number of themes. So both specialists and GPs agree that it improves the ease of access to a specialist. It's easier to get specialist advice. What Marielle also said, that they saw some unnecessary referrals in the hospital. The specialist in the interview said, well, a lot of these seem to be avoided now, and the GP is happy to keep this patient in the care of the GP, which is often less stressful for the patient. Next slide. If you look at communication, both agreed that there's practical benefits compared to a telephone consultation. The e-consult is also saved in the shared patient report. They do say that communication is a bit more distant now. And next slide. They also spoke about an educational value of this e-consultation. So there's knowledge exchange, which mostly has value for the GP to learn about stuff. And they said that even they would like to see this involved in training. Some GPs even mentioned that they save these e-consults to read back. Next slide. And even if a patient was referred, the hospital specialist said that they are now better prepared for this face-to-face visit. They have already seen the case. They have all the documentation in this shared patient file. Specialists say they saw no effect on the workload, and GPs had mixed opinions about it, with some saying that it had no effect and some saying that it did increase their workload a little bit. Next slide. So what about the patient himself? So the patient does see practical benefits in terms of cost and time saving and staying in the care of the GP. They're not actively involved in the e-consultation process. They also do not wish to be, as long as feedback is given to them in a good way. But this is all dependent on their personal preference about a referral. So some patients do want to speak with the specialist themselves, look him in the eye. Also dependent on their relationship with their GP and the severity of the complaint. So if it's a really severe medical complaint, they do want to be referred. Next slide. Lastly, so what's next? We're going to look at the surgical departments, because we do see that the numbers of e-consultations for the surgical departments are quite high, which we did not expect. So we want to see if there's substitution of care there as well. We want to do a cost effectiveness analysis. And what's also good to mention is that at the Department of Family Medicine of the University of Maastricht, which we're working with, there's also a broader project on digital interdisciplinary consultation in Dutch primary care. And then I think the last slide, if you have any questions or comments, please feel free to email us. And thank you for listening.
Thank you, Marielle and Ken, for providing us an insight in the project that you have run over the last years. I think there might be questions from the audience, so I'm just looking at my colleague. Are there any questions for Marielle or Ken on the project?
Great improvement of efficiency. If you were to set up this project again, what kind of support would you ask from THCS?
Okay, the question is, if you would set up this project again, what kind of support would you ask from a program like Transforming Health and Care Systems? So imagine yourself being back in 2016, I guess. What would you have requested from a program like we present today? Or maybe not at all. It's a question to you from the audience.
Yeah, Ken, I don't know if you have, I think that because it's so in this region and you have to know the people you want to work with, that I don't think that it would have been helpful in any way, but maybe I'm wrong. I think that what was most helpful, that privacy legislation wasn't as strict as it is now, and that's why it was easy, and that also the health insurance company was actually quite easy. So I don't think that it would have helped. What do you think, Ken?
Yeah, I'm not sure, to be honest. Wasn't around back in 2016 already.
Maybe
I see there's another question too.
Maybe if it's possible to give a project a sort of rating that you can say to the health insurance company, look, this international organization thinks this is a very good idea. Maybe that's helpful. That your idea gets a sort of rating, and it's helpful to get it paid, because that's mostly the problem.
Mm-hmm. I think there's also a question on that regard, if I'm not mistaken. I see there's a question on how does the implementation in the health sector nationally looks like after the research part looks like. So how is that done?
Well, the health insurance company, which is in the southern part of Netherlands, the most important company, they are trying to spread it throughout the Netherlands, but it's not really that there's an organization who takes care of that. It's by hearsay. It's by that I've been called by colleagues in other hospitals, and they ask me, how did you do that? So it's not really, there's no organization who tries to implement this in all hospitals, which should be possible. So everybody is inventing it, by themselves. So that's a pity, because it's a lot of time.
So hopefully today's presentation helps a little bit in spreading the news, let's say. So let's hope that. I look at my colleagues to see if there are other questions.
Somebody asked whether they get a patient-reported outcomes.
Did you gather patient-reported outcomes? That was a question from the audience. So I think it's more on the patient side, I mean, well, how they experience this change in treating people as a GP.
Yeah. Ken already said that they were pleased because when there's a good relationship between the GP and the medical problem is not too big, then they are very pleased, because normally when they go to the hospital, it costs them 385 euros, and it costs them nothing when they stay at the GP.
And so we held interviews with patients. We did not do any questionnaires or something like that, if that's the question. We only did interviews to see which teams come up with patients.
Okay.
There was also a question about privacy.
Okay, there was also a question about privacy, but you already mentioned, Marielle, it was not that harsh when you started, but how's this today? How do you deal with privacy?
Now, the referral system is a normal referral system also for physical referrals. So that's what we use. And the letters that we send back are also via the same mechanism as when we see patients. The only thing is that in our EPD, I don't know if it's a good word, EPD, electronic patient dose file, and now we have a mixture of patients who are really in hospital and are seen physically, and also the budget of the hospital is it's not, how do you say that? And these patients don't come, and they are paid in another way. So it has nothing to do financially with the hospital. We pay the hospital, but the hospital doesn't send these lists to the health insurance company to get paid. So normally you can't mix these patients in your electronic patient file. So if we would implement it now, that would be a problem.
Okay.
Because it's technically possible that you get twice paid if they're in your outpatient clinics. Normally, we code these patients and we get paid. But these patients with e-consultations, we don't give a code. So it's paid in another way. And that's not really how it should be. But they condone it. How do you say that? Condone it.
Thank you. A final question to wrap up, because we otherwise would run out of time for the other subjects, I guess. There's also a question whether there was dropouts from GPs that dropped out of your project. And did you also ask why they potentially dropped out?
I think every GP has sent in at least one e-consultation. Of course, there's differences in how many they send, but I don't think we had any dropouts. It's just the amount they send, personal preference.
Well, it's not, they are free to use it or not. So there are general practitioners who never do it. And usually it is because they don't read their letters that it's possible. But, and maybe there are general practitioners who think it's too much bother and they rather refer patients physically, but it's not, it's free to use it. So we don't have dropouts. Maybe we have GPs who don't use it.
Okay, thank you. Given the time, I think there are more questions I saw in the chat, and I saw my colleagues also that there are more questions. So I would urge people that have questions, please take the opportunity to get in contact with Marielle or Ken and ask your questions, because I think they can tell a lot about their experiences so far. From my side, I would like to thank you very much for joining us and sharing this story about what you have done so far. And I would like to hand over to the next speaker. So thank you very much and have a nice afternoon.
Thank you.
Because now, I think some people already asked, is the call already out? No, the call is not out on the website yet. So, but we will present the call today in the webinar. So we have our colleague, Michael Joly from the French funding agency ANR. Good afternoon, Michael.
Good afternoon, Ray. Nice to be with you.
Nice to have you on board. And Michael will take us through the call and what the call will be about and what the aim of our first call is. So Michael, the floor is yours.
Cool, thanks. Okay, thank you. So as Rick mentioned, I'm Michael Julie from ENA, the French National Research Funding Agency, and I'm also part of the THCS call secretariat. So today I will talk about our first transnational call for project, and next slide, please. So just maybe before going into details about the call, I would like to give you some context. As Federico mentioned, THCS is part of a European partnership within the framework of Horizon Europe and from the European Commission. And basically, I would like to highlight the added value for you and for us of participating in. So launching calls through this instrument is allowing us to use more efficiently resources from the regional and national level towards common goals. And it is also allowing us to align research priority at the European level and beyond. As for instance, we have the participation of Israel in this call. And basically, instead of having several regional funding program on a specific topic in each country, we will gather our efforts into one transnational call for project. And each funding agency will fund research carried out in their own country. It is also important to note that the EC, the European Commission, is contributing roundly to these calls, notably by covering management costs to run the calls, but also directly by co-funding research projects. Okay, next slide, please. So it's not only an added value for us as a funding organization, but also for you, as you can have access through this transnational collaboration to resources that are insufficiently available in your country. It could also benefit the society as a whole, as certain topics goes beyond borders, as pandemic, for instance. And it's need to be tackled through international cooperation. It could also help boosting the technological and digital European ecosystem or support the harmonization of healthcare systems, something we will try to do during the next 7 years in THCS. And also, so it will leverage funding on a specific domain. And finally, for you specifically, it could be a first step, encouraging you to participate to other funding instruments of Horizon Europe. Next slide. So, okay, and so now let's move on to THCS Transnational Call for Project 2023. Called Healthcare of the Future. So this is the first of its kind, even if we are capitalizing on the work done by previous initiative as More Years Better Life or To Reach. And this call will be the first of many for THCS. So the call secretariat will manage the call and the evaluation process. It is composed by ZonMW from the Netherlands that are hosting the webinar today, by the NCBR from Poland, and by INR from France. Next slide, please. So as you understood now, it is a transnational call, and 36 funding organizations from 23 different countries are participating in. This funding organization could be regional, national funding agency, Ministry of Health, Ministry of Research, or regions. The budget for this call, for this first call, is about 35 million euros. And as I said previously, it is co-funded by the European Commission. Next slide. So Federico already presented you the objective of THCS and its vision. But as we wanted the first call to be broad, I'd like to highlight some challenges faced by the healthcare system that we aim to address through the first call. So I won't probably teach you anything by telling you that our population is aging, our lifestyle is changing. So we will face, or we are already facing, an increase in chronic disease, for instance. And that represents an important cause for the healthcare system, but also for the people. So some of the levers to address this challenge could be better health promotion, better prevention, earlier diagnosis, or new or better care pathway and care delivery. Again, it is not news, but it's in every media now, at least since the COVID pandemics, but there is a shortage of the workforce. Healthcare systems are under pressure, there are strong financial constraints, then some solution could be training and upscaling of healthcare professionals to new approach, to new practice. It could be also a better task redistribution, the implementation and integration of digital and technological innovation, also new models of care and new financing models. And finally, we would like to work towards reducing health inequalities and improving the healthcare access within and amongst healthcare systems. So we would like to better take into account patient and citizen preferences. We also think that we can do that through better care pathway by improving the continuity of care, integrated care, healthcare systems that are more distributed, and by engaging patient and citizen. And for more details about the different challenges we identified, you can also consult our strategic research and innovation agenda in our website. Next slide, please. So basically, the overall aim of the call is to relieve the pressure on healthcare facilities, notably hospital, and ensure patients receive the appropriate cares according, of course, to their medical condition and also to their preferences, and through a smooth healthcare continuum. That could be done by optimizing the complementarity of inpatient and outpatient care, by developing people-centric care, by improving the continuity of care, or even by implementing digital and technological solutions. So this could be done either with proposal aiming at filling the gap, or with proposal supporting the implementation. But in any case, we would like the proposal to consider potential economic and social impact, or both, or even show how the result of the project could be translated into policy. And this is because our overall aim is to transform the healthcare systems. Next slide, please. So the big question could be how to optimize and better organize health and care system. And to be clear, we are not asking you to address both aims, but rather to pick one approach. And I will try to give you more details on what we expect by giving you some examples in the next slide. Next slide, please. So I don't want to bore you by reading this slide, but note that we are looking for solutions, models, strategies, quality measure, methodology, all supporting structural changes, care delivery, or care settings, even implementation strategy or testing, demonstration, adaptation of intervention for continuity of care, for people-centric care models. We also believe digitalization and technologies could help us transform health services and improve patient and citizen satisfaction. We are looking for solutions using more efficiently resources, both financial and human, and improving the attractiveness of the healthcare sector, sorry, and the daily life of the workforce. Proposals could also look on how to improve health promotion and prevention and how to better engage patients and citizens in their own health. Next slide, please. So additionally, we are not only supporting transnational collaboration, but also multidisciplinary and intersectoral collaboration. We aim that different fields will work together with different stakeholders towards implementation in the healthcare system. As such, proposal will be rejected if they are only, for instance, preclinical biomedical, or if there are only epidemiological studies, or only concern social and welfare services, or only about digital and technological development. Next slide, please. And to finish and close the loop. So for this call, we expect to contribute having more informed and engaged patients and citizens with an access to a more distributed community-based healthcare facilities, included new concept of care, of prevention models, of personalized approach that could be translated in different contexts and settings. We hope to contribute to the development of primary care and community-based healthcare services, able to prevent, to monitor and manage age-related diseases, condition and disabilities also, and at the same time promoting healthy lifestyle. And also we aim at improving and facilitating the work and practice of healthcare providers and professionals with solutions for the delivery of care. And we aim at providing healthcare authorities and policymakers with evidence-based strategies, supporting the transformations towards people-centered services and the optimization of the delivery of care. And next slide. So yeah, that will be it for me. I'd like to thank all the funding agency and specifically the Norwegian agency, and notably Christine Andersen, who was instrumental in the development of this call text. And yeah, I think we can take some questions.
Thank you, Michael, for presenting the topic of the call. I look at my colleagues. Are there questions at the moment? Okay, yeah, I saw that there are several questions, and I think I will touch upon them in the next presentation because that's more on the procedures and the criteria. And I thought there were some questions there. So hopefully in the next presentation, I can answer those questions. So if they're not answered after my presentation, then please don't hesitate to put them in again in the chat. I think just bump immediately into the next presentation on the call procedures and criteria, because that would hopefully give some practical guidance on how this call is arranged and what are the requirements that need to be fulfilled to be applicable and eligible for funding. Can I get the presentation on the screen, please? Okay, yes, thank you. Let's start right away. So this call, it's a one-stage call. So there's no pre-proposal like sometimes in other partnerships is the case. The duration of a project can be from 12 up to 36 months. So it's up to you to decide what is the appropriate length for the ambitions and goals that you would like to realize in your project. So we have a lot of flexibility there. Although it is a one-stage call, we do ask for an intent to apply, which is just a kind of showing that you have an interest in applying for this call. Be aware that this is mandatory, so every consortium or every proposal has to submit an intent to apply to be eligible and to be also taken into account for the review. So this is a very important thing. I will come back to it later on in the timeline to tell you about the deadline of this intent to apply. Then, and also an important thing is that a proposal can be rejected if any of one of the partners in the consortium appears to be non-eligible. So it's very important that you check the eligibility criteria nationally or regionally, depending on the funding agency that you are asking the money from, to see whether you are eligible. So please get in contact with them if you have questions about these kind of criteria. I know hopefully the call will be out soon in a couple of days. So then you will be able to read all the criteria for each single funding agency and also the one that fits your proposal. Then I think it's also good to mention that it could be, and there again, you have to check the national or regional criteria, that additional documentation is asked on a national level. So this can differ from country to country or from region to region. So that's, again, it's very important to take a close look at those criteria. Let's go on. Then, how should a consortium look like? So what is the composition of your consortium? In this first call, we said we have a minimum of 3 partners from 3 different participating countries. So at least 1 partner from each country has to be there to be eligible for funding. And you can have up to 9 partners in total in your consortium that are eligible for funding. Then there's a maximum of 2, because we think it's very important that this collaboration among countries is really taking shape. So we said we would like to see a maximum of 2 partners per country, so that not one country has a lot of partners and the other one has only 1. So this transnational aspect is really important. That's why this criteria is set. Then it is possible to also allow self-funded partners, so that don't apply for funding, but they just would like to join because it's very interesting to them to be in this project. We offer this opportunity, but with a maximum of 2 self-funded partners in a consortium. So be aware of that when you are searching for partners. Another thing is that this one applicant can only be project coordinator of only 1 project proposal submitted to this call. Maybe it's good to say that it means that for an organization, you can have several people applying, but not the same person as a coordinator for more than 1 proposal. So keep that in mind. And again, I cannot say that enough, I'm afraid. Check your national and regional eligibility with the right funding agency that fits to your location. Then we go to the evaluation or the review of the proposals. There are 3 main categories on which the reviewers will base their assessment. So it's excellence, the impact, and implementation. When we're talking about excellence, you should think about how relevant is your project to this call? What is the need for this project in society or in the field of research that you are aiming at? How novel is your approach or your project? How ambitious? These are all things that have to do with excellence. And then we move to impact. So there you really have to show how your project is, or the project outputs that you deliver, how they make a difference and to whom. So I think the reviewer should have this clear when reading your proposal. And finally, the last point is in the implementation. And there you really show how you execute the project and how the project is managed and how this is done in a sufficient way that is suited to the goals and the aims of the project. So I think this is very important that the reviewers understand this also, how you intend to implement the project you are proposing. Then the timeline, as being said, which is very important, of course. The first deadline that is there is the deadline for the intent to apply. So it's just a short form. You will get, when the call is out, you will also get this form, and you will see what it's just a couple of questions to give us as a program an idea of what you would like to propose, and let's say with whom you would like to send in a proposal. So it's not much that you have to write, but at least it gives us an idea how much and how many proposals we can expect. And the deadline for this form is the 23rd of May this year. And this has to be sent in online in the online submission tool. And you will get a link on the website to the online submission tool once it's out. So that will come also later. Then I think, so you need this first deadline to send it in, because otherwise you are not taken into account for the review stage afterwards, of which we have the deadline set on June 13. So this is the deadline for submitting your proposal. And to be clear, it's exactly at 2 in the afternoon, Central European time. So keep that in mind. Of course, this will all be in the call documents as well. So both deadlines are at 2 in the afternoon, Central European time. Then in the reviewing stage, we have a rebuttal stage, which allows for project coordinators to give responses to the feedback and questions that reviewers potentially have. This phase is planned from 29th of August until the 6th of September. Please keep those dates in your agenda so that at least the project coordinator will receive an email then. So you should be somehow close to your email to be able to respond, because this is an opportunity for you to maybe help the reviewers to better understand your proposal. Then at the final stage of the review, it will be in October that we expect to communicate the results to all our applicants. So everybody will know whether your proposal will be funded, yes or no. And then the next stage is that you will go to your national or regional funder, and they will get and shape the contract. So you are nominated, let's say in October, if you potentially for funding, and then the final arrangements are set with the regional or national funders. And then we hope to start the projects between December this year and May, probably by the latest, in 24. So it will take quite some time before applying, before you really can start the project. So keep that in mind. It's a long road, but in the end, it can pay off. Okay, there is some room for questions. So please feel free if you have questions on these call procedures or criteria which are not clear yet. I'm just taking a look at my colleagues to see if there are questions at this stage. Okay. Michael, I heard you were wanting to answer one of the questions that was put in the chat. So please feel free to answer the question that you had in mind.
No, actually, it was maybe the participation of industry, SME, and pharma to the project. So I was just saying, yeah, it could be possible, at least at the global level. It's possible, but it will depend at the end on the regional national funding organization. So because some funding organization will allow the participation, or will allow the funding of industry, of SME, but some other won't. Maybe you want to complete.
Well, I think that's a sufficient answer, I would say. I saw another question on the amounts, I think on the budget. I think there it really depends on the national or regional criteria, how much you can request for a project. So I cannot give an answer in general terms. So it depends. That's why I said it's so important to take a look at those national or regional criteria in the call text. You will find those there's an annex in the call text where you'll find all the regulations for each funder. So that really depends how much a partner can ask for funding and what is the maximum for a project or for a partner that has been set. So there's no fixed answer, let's say, for everybody in that sense. I saw also a question on, is it possible, is it only focusing on aging? No, it's for the entire population, this partnership. So if you have another group in mind or another target audience that you would like to focus, that is possible.
And also, Rick, there is a comment about a question. Is it possible to address specific pathologies or department to test new strategies? And yeah, of course, it is possible. It doesn't have to be global.
Exactly. Yeah. And I also saw some questions about whether some countries were in or out or participating in this call. For instance, I think Germany passing by several times. Unfortunately, Germany is not participating in this first call. It could be, of course, for German partners, they could join as self-funded partners, but they cannot ask or request funding since there are no German funders involved in the call, unfortunately. And this could be the case for other countries as well. So if your country or your region is not in, it is possible to join self-funded, but you cannot ask for funding then within this call, unfortunately. Again, there's a question I see on whether industries and SMEs are allowed to participate. I'm repeating myself, I'm afraid, but again, this depends also from funder to funder. So for some funding agencies, it is okay to have companies in, and for others, they cannot fund them. So you have to look at the criteria in your country or in your region to see what they allow in terms of the type of partners. And again, you will find this in the annex of the call text. Also, the percentage of the budget, that's also asked, is this, and there again, that's also different from country or from funder to funder. So I know it is making things complicated, but we are in a international cooperation environment. So then, yeah, it changes from funder to funder.
Yeah, and because we are funding only the research performed in our own country or regions, so it has to be linked to this.
So there's a question also on the intent to apply. It is possible to add partners after the intent to apply, potentially, because there is some room between the deadline of the intent to apply and the final deadline for proposal. So of course, if the proposal evolves and you feel that an extra partner is needed or a change of partner is needed, that is still possible. But of course, the more you have your consortium already shaped, the better it is, because it gives them more insight. For the rest, when it comes to the form itself, we will also put that on the website soon. But it's mainly, we will ask for, let's say, the partners that are in, and for a small summary, let's say, of half a page maximum, to have an idea on what you are focusing on. And that's basically the main thing, and it has to be filled and sent in by the project coordinator. So not separately by all partners, but only by the coordinator. So that's in a nutshell what you can expect from this intent to apply. So we try to reduce the burden of how much information we ask in the intent to apply. But of course, in the full proposal, we expect all information to be there. So it's more an indication for us. I saw there are also questions, and I think that links quite nice to the last topic that we have, on how to find partners. After this part, there will be one presentation from our Polish partners on a partner search tool that they provide. And in this tool, you can make a request for finding other partners to build an international consortium. So in a bit, they will guide you through their platform and show you how this works. I will see if there are still other questions. There are many questions, but of course, given time, we cannot answer them all, but we will save the chat so that we have all your questions. And hopefully when the documents come online, this will really help to answer most of your questions, hopefully. Another question I see is, okay, will there be a call every single year within the next 7 years? Of course, we will plan more calls. This is not the last one, it's the first, but definitely not the last. We don't know exactly yet whether there will be one every year or there'll be maybe even 2 in a year. This is not decided. As we go, we will see how we go along with the calls. But of course, there will be more calls following in the coming years from our program. I'm just going to have a small look at the time. I think there are more questions, but maybe at the end we can come back to some. But let's first now jump to how to find, because there were questions, how do you find partners, which is not an easy thing always in international collaboration. So I would like to give the floor to my Polish colleague, Marcin Jumelski, to give us a little bit of introduction in their partner search tool and how you can make use of this instrument in finding partners. Marcin.
Okay. Hello, thank you. My name is Marcin Chmielewski, and I'm representing National Center for Research and Development, as long with my colleague Mateusz Skutnik. But I'm not sure if you can see the screen. I can see only.
I have a black screen, Marcin,
yeah.
to be honest.
Yeah.
So if it's not working, then we could switch to the presentation.
Yes, just give us a few seconds.
Okay.
Mateusz will try to do something, I hope. Oh yeah, can you see? I can see.
Now it's working. Okay, great.
Oh yeah,
go ahead.
Okay. So we are aware that creating a consortium or finding a partner can be sometimes very complicated. So we want to present you some information about specific partner search tool. I will put immediately the link to this partner tool on the chat, so it is available now. It is a very simple tool. We are trying to keep it as simple as possible. So when you enter this page, you will see something like this. So you can see the announcements that were created earlier. You can see who is looking for partners, what is the topic of this announcement, the brief description, and of course countries that are searched. And you can also filter those announcements with advanced filters. So you can choose type of collaboration between partner and project, announcing countries, partner type, of course also classification areas, and which is quite important, you can choose from specific calls. So I would advise you to look for THCS partnership announcements. It is now empty, but I'm sure that it will be full of announcements very, very soon. And this is mostly all that you can do at this moment without logging to our application. So if you would like to see some details of those announcements, to receive the contact information for announcement authors, or create your own announcement, you need to create an account. So to do this, you need to click this button, your account. And if you don't have account yet, at the bottom, you can see a register button. So please use it. And after a brief register process, you will create an account. And if you have one, you can log in like here, like Mateusz is showing. So yeah, you will log into our application, and you will be transferred to this page. And as you can see, there are a few extra buttons like details, unfollow, and report violation. So within each announcement, you can do some specific tasks. And when you click the details button, so Mateusz, please click one of them. Yeah, you can see the details of this announcement. So you can see a project title, partner type, classification areas, description, of course, the type of call, keywords, and of course contact details to the author, so you can contact with him and create some collaboration. But within your profile status, you can also you have access to my announcements area, when you can see your announcements created earlier. And with actions button, you have the full access to all details connected to this announcement. You can edit this announcement, finish it, cancel it, prolong if it has a short expired time. You can also withdraw it. There are also another option when you click the My Followed announcements, you can see your, let's say, favorite announcements sorry, because each announcement can be added to this list, so we can later check the details of the announcement that you were interested in. And the shortcut to those options are at the top of the screen, so you can immediately create new announcement. With the hard button, you can jump to my followed announcement, and with this another button, you can jump to your announcements. So it should be easy to use. What is the most important is a new announcement button. So you can click it and create your own announcements. You can create one or more announcements. It depends on you what number of announcements you want to create and for which program or call. After clicking this button, you will see this form. So we will need to put some information. Don't forget to click this button with THC partnership. You can add, of course, more calls or programs to this filter, but please create at least THC partnership button, so other users will see you as they pick this with advanced filters option. Yeah, and also contact information, so you can put this information that will be visible to all participants that are clicking to your or entering your announcement and willing to create some or to start collaboration. And don't forget to click this button, add announcement button. So when you do this, you will jump to my announcements area. So Mateusz, please click to my announcements area, and here you will see your announcement. The status will be ready for publication. So don't remember to click publish button. So then all the users will see your announcement within this main window. So they will have an opportunity to click it and to receive your contact information. So it is very simple. Like I said, we're trying to keep it as simple as possible. If you encounter any problems, so please contact us. The contact info is here. It's partfinder.ncbr.gov.pl and partfinder@ncbr.gov.pl. And I would like to also mention that this is the optional tool. It is not mandatory to create an announcement to successfully submit a proposal during the call process. But this tool will help you to create a consortium or to find a partner if you need to find, let's say, one or two or more. Yeah, so I think that's it for now. If you have any questions, so please write them on the chat. Thank you.
Thank you, Martin, for showing us the tool. I think this is quite a helpful instrument for applicants to find other potential partners. So please make use of it. Are there any specific questions on the tool that was presented? Just looking at my colleagues to see if is there any specific questions so far? Not yet, I see, or at least maybe already answered. Then I thank you very much for showing the tool. Of course, we will also spread the link on the THCS website, so you will find it there soon as well. Then I would like to round up and finish the webinar because it's almost 2:30. Maybe just as a final slide or final picture, more information, because that's the thing that everybody is waiting for. As I said, the call text itself with all the things described in all the countries and the criteria for all the countries will be online soon. And you will find the call text on the THCS website, which is thcspartnership.eu. So then please stay tuned and follow us there. If you have any questions regarding the submission of your proposal, then you can send an email to the call secretariat at thcs@zonmw.nl. But keep in mind that if you have questions on the national criteria, then please first always contact your national contact point or contact person from the funding agency, because they know best on all the criteria nationally. And the call secretariat, of course, is always willing to help, but we are not the specialist when it comes to all the national or regional rules. So I think that's always the first point of entry. And then, of course, we are always there if you have any problems also in terms of technical problems in the tool maybe later on or when you want to submit things. A third thing that I would like to mention, it was already mentioned by Federico as well, the THCS partnership has a LinkedIn page. First of all, it's nice to subscribe to this page because you get news and updates on events like this. So this is the first webinar, but there will be more. So please subscribe so you get the news when there are more webinars or events planned. But on top of that, I think it's also a nice way of finding partners. So the more people that subscribe to this LinkedIn page, we build a kind of community there, and you will find partners also there potentially. So I encourage you all to subscribe to this LinkedIn page so that you can find partners from other countries there as well. And last but not least, I think the address of the partner search tool is also there, and you will get it afterwards when we send round, or you can just have a look again because it will be recorded, this webinar. So you have the opportunity to have a look again or send it to other people afterwards that didn't have the chance or the opportunity to be with us today. That was it from our side. I would like to thank all my colleagues today who helped in shaping this webinar. So everybody from the call secretariat, our French and Polish colleagues, Federico from the coordinating team, thank you for presenting something more on the partnership, and also to Ken and Mariella to presenting their project. This is the beginning of the first call, so hopefully more information will follow soon on the website, as I said, and we will be back, of course, also with more information events planned in the coming weeks and months. So please follow us, and we hope to see you again soon. For now, I wish you all the success with shaping the proposal, because it's May or June is quite soon already, we know that. So we wish you best of luck and in shaping that. And for now, enjoy the rest of your day, and it's goodbye from us. Bye-bye.